for home care, for kind of home program stuff, are there like 2 or 3 things that no matter who comes through your door for pregnancy related care, you want them to be doing that at home, that we could kind of
Absolutely.
let people know here today? And if you want to demonstrate them? Or...
Absolutely.
Okay, Josie, so when you have clients walk into your clinic who have pregnancy related pain, or common back pain, SI pain, regardless of who they are, where they came from, where the problem's coming from, are there 2 or 3 things that you want all of those patients to know when they leave your room?
Yep. 3 big ones for me: hinging, breathing, and bracing.
Breathing, love it. Okay, but talk to me about hinging. What do you mean by that?
So hinging is the ability to bend forward without rounding and crunching through that low back. Increase pressure through the lower lumbar spine, especially those discs, creating that irritation and inflammation, especially when we do it repetitively. So the big piece is, I really don't like when moms get down and we get in and we try to pick something up.
And your feet are so close together too, right?
Exactly.
Like
we try to do
dainty lifting, right?
So not the way it's supposed to be.
So show me what you want people to do.
The idea is get a little bit wider, find a comfy hip position, and it's going to be different for every woman. For me and my pelvic positioning, I like to toe out a little bit, get a little bit wider.
I like that you brought that up, because I think, especially like in fitness communities, tends to be the idea that there's this one specific posture for everybody and a specific toe out, and our bodies are too diverse for that. Okay, I interrupted you. Go for it.
So we'll find that nice, comfortable stance that you can kind of lean into. And then 2 ways I like to teach this is usually I'll even stick a dowel or a broom handle on somebody's back.
That's a PT trick too.
I like it. We're on the same page.
Yeah, always.
Right? One hand at the tailbone, one hand at the back of the head, and then that dowel should rest comfortably between the shoulder blades.
Okay.
And then when somebody rounds through their low back, that one lower hand is going to kind of pop off that tailbone, and it shows them like, oh, I'm not bending properly. So it's a good little reminder for people like, okay, this is a good way to work into that. Second piece is think about just setting some fingers, right?
Find your creases, right?
Find your creases,
send them
backwards. Exactly. So whole concept here, get down, and whether it's a super heavy box or something light, picking up a child, that sort of thing, it's find those creases, sink into the knees, grab through, lift and fire through the glutes. Thinking about a good core brace at the same time. And so that core brace is another real important piece for us to be playing with, is really finding all those areas. And at the beginning of pregnancy, it's a lot easier for the women to find, and in pregnancy, it's a little bit different to work into those pieces. So it just depends on the woman's time in their trimester, or pre, post, whatever we're kind of working at, but learning how to engage that abdomen and see if they can fire into different areas, and just getting hands-on with them and empowering them to go, hey, where's my core? And, oh, can I push into that area? Working on that, and then learning how to breathe.
Breathing. Breathing and lifting have to be together.
Exactly. So we sit here, we go really fast, and we get going, and oh yeah, I'm lightheaded, and I can't breathe. We got to get that extra blood volume that we've got going, pumping through there a little more effectively. So really, we're learning how to breathe into that, get that nice deep nasal breath on the way in, engage, and then fire, pick up what you're doing, exhaling through on the way out.
There's some good, there's a PT down near LA named Julie Wiebe, and she I've enjoyed her stuff for a long time. It makes sense. I have a bachelor's in engineering, so I like how Julie uses kind of very physical models for this, and she talks about your diaphragm and your pelvic floor being like a piston, okay? So as we inhale, the piston's coming down, you're creating space, your pelvic floor is lengthening and opening, and then the exhale, that exhale, the diaphragm's coming up, bringing the pelvic floor along. So the idea of using your breath as a way to recruit that pelvic floor and deep abdominals, so that we're not trying to lift and then holding our breath and lifting, which almost always causes pain or extra pressure. You can think, blow before you go, and blow as you go, and that's a hashtag, blow before you go, hashtag, that you can look through Instagram, Facebook, and find a lot more examples from Julie's work and other PTs, really teaching that recruitment strategy.
And that's one you shared with me when I was going through this recovery process myself, and I share it with patients regularly because it's such a good piece.
Yeah, if you're feeling any kind of, we've been talking about the musculoskeletal pain in pregnancy, but it's also really common for people to have their first experience of feeling pelvic organ prolapse, or pelvic congestion. You can have like just kind of dull achiness in the vaginal region in your perineum while you're pregnant. And that can be related to, you know, the weight of the baby coming down and sending your pelvic organs down. But it also can be because of that increased blood flow, and we're restricted through here. And those blood vessels and lymphatic vessels are kind of filling with fluid down in that perineal region, and it can be really achy. And learning how to use your breath to kind of help pump those fluids back up can really add to comfort. So we don't want to round.
No rounding.
We want to send the creases back and below as we go, right? Awesome.
I love it.
Beautiful. So you said hinging, breathing, what was the bracing? All right. So the breathing and the bracing can go right together, knowing how that works.
Absolutely.
I agree with you. I think that learning how to lift and use that breath, not just with lifting, but also as people roll over in bed, move from a sitting to a standing position, getting in and out of the car, are really important times to use that breath. And with some of my clients who have really, with higher levels of sacroiliac pain and pubic symphysis pain, getting in and out of the car can be one of the most painful things for them to do. So in addition to this, I say, hey, you know, honestly, like if your SI pain is so bad that, yeah, while we're working on all this stuff, you're starting to limp and alter your gait, please use a crutch, please use a cane, get a walker at home if you need to. One of the other tools that I like to let my pregnant clients know about, especially if they're having a lot of pain with getting in or out of the car,
It's a big one.
is a huge one, right? Especially with pubic symphysis dysfunction and SI joint pain, is a pretty simple device called a swivel seat cushion. Okay.
Is this like a lazy Susan?
It looks like a lazy Susan. So there's a plastic bottom to it, and then it's got this cushy pad, and it's round, and it's a lazy Susan for your butt. So you put it on your car seat, and then when you go to get out of the car, instead of it being this whole ordeal of putting, you know, I don't have my pelvis model here with me, wanted to keep it simple today, but you can just imagine how that pubic symphysis is stretching and all those ligaments are going, ow, ouch, as you get out of the car, right? So you can keep your knees together, knees, hips, shoulders together, take a nice deep breath, grab onto the steering wheel and the poop handle at the top of the car door, and use that breath and spin your body to the side to get out of the car. Granted, nobody gets out of the driver's seat that direction, but you know what I mean.
I'm following.
All right, switch places with me. You're the driver. So we talked about relaxing and just those general, the loosey-goosey, the additional load in the body. Swivel seat cushions, crutches, compression belts. Do you have a favorite compression belt?
I do.
Okay.
It's a special off at Amazon that I order. And
What's it called? Let's link to it. Okay. We will find it.
Yes.
We will find Josie's favorite compression belt and link to that. Compression belts can be a lifesaver for people with SI pain and pubic symphysis pain. Because you wear them, you sling it low around your pelvis, and they're not a be-all and end-all, but they can save you energy and time. My favorite that I try with most people right out the gate is a brand called Serola, S-E-R-O-L-A, okay, the Serola belt. We'll link to it in the comments. And you know, you just measure yourself around the pelvis and order the size that works for you. And if you get it in the mail and you don't know what to do, go find one of us. Go find your local PT that can help you fit it and just make sure that you're wearing it optimally. I'm not a huge fan of most of the maternity garments out there because I don't think that they provide enough compression to the pelvis to really overcome that change in.
Well, I found them to be terribly uncomfortable.
I always agree. Yeah. So the Serola is an orthopedic belt, not maternity belt.
Absolutely.
Awesome. The other things that I like, a lot of people who come to me for round ligament pain or SI pain, tend to find that they're pretty darn tight through their hip flexors.
Oh, absolutely.
Right?
That's a big one.
And their inner thigh muscles, the adductors. So they're
hip rotators as well.
yeah, and that low back. So there are 3 stretches that I like everybody to know. If I have to pick from everything out there, 3 stretches that I like all my pregnant clients to know.
Absolutely.
Because most of us are pretty darn tight in our hip flexor muscles, which span from our lumbar spine to the top of the thigh. We tend to be really tight in glutes. That can refer as that sacroiliac pain. And in our inner thigh muscles, the adductors. So let's do 3 stretches. Is that good?
Yes.
All right, we're gonna start with a standing hip flexor stretch. This can be really simple. So you see how Josie's got, face the other way, I wanna see the daylight. So she's got a little bit of daylight between her feet, right to left, and one foot just directly in front of the other, and I like how your back toe is pointing straight forward, okay? We can want to go into yoga warrior, and that's not what this is. This is a hip flexor stretch, okay? Simply, we're just gonna lunge forward, keeping our tailbone tucked under, so you start to feel that stretch come through the top of the thigh. And if you can sink that back knee down a little bit and really feel that stretch come through there. The key here is to make sure that you are keeping your tailbone tucked under, because if you arch the back too much, it takes the hip flexors out of it. So tailbone tucked under, and if you want to add a little extra love to this, and you can balance and do that at the same time, on the side that your leg is back, you can reach your arm up, and you can add either side bending or a little bit of rotation. These are chicken soup stretches. Everybody feels better when they do that.
Absolutely.
And if you're feeling like it's hard to balance, especially when you're pregnant and your center of gravity is changing all the time, you can simply just have a hand on the counter. Put a hand on the counter, a hand on the wall, and use that for balance. I like to do that anyway, then I can focus on the stretch. So that's a standing hip flexor stretch. The next one is an adductor stretch for your inner thighs. So feet, facing forward or toe out, whatever works for you. Feet as far apart as you feel comfortable. Find your creases. Find the creases at the top of your thigh bone. Then I say, take your right crease and try to shove it toward your left foot. Feel that little stretch show up right at the thigh bone to the pelvis. Then hang there for a little bit, and then go to the other side. It's like the I'm a little teapot.
I find for this one myself, being able to rotate
Oh,
slightly
little
through the
rotate?
pelvis, you can find different
Yeah.
areas with how high and how low
Amen.
it gets through there.
Every person, you're gonna feel it. You're the only one who can feel your body from the inside out.
Absolutely.
So get the basic idea and then play around with it.
Exactly.
See what works for you. There's no hard and fast rule. Last one is a standing prayer stretch. So kitchen counter, dining table, honestly just hands on a wall in half moon pose works really great. Just reaching through, you're getting a stretch through your lats, through your low back, definitely through your glutes. And I always feel it a lot in my hamstrings and calves. This whole chain can just get really tight. And it's a nice way. In this position, you can, again, you play around with, maybe you want to do a little cat-cow and feel that lumbar spine, or mostly just cat. Because when you're pregnant, you live in cow, so you don't really need to go to cow. Just cat to tabletop. You can sway a little bit side to side, feel this side open up. You can play around with how wide your legs are and how far away from the wall they are. And you'll just feel it. You're gonna feel it where your body needs you to have it. But it's a really easy one to, if you've been on your feet for a long time or you've been sitting for a long time, just go to that for a minute or so and then move on with your life. The best posture is the next posture.
Yes,
Okay?
I agree.
So we just want to make sure that we're adding some variety to our day, especially in pregnancy. So those are my 3 favorite stretches for pregnant clients.